There are environmental factors, environmental exposures. There are the fact that men are very heavily represented in the most dangerous jobs we have in our society. And there's really quite a substantial gender difference there, which accounts for that statistic that Larry mentioned before, which is that 97% of workplace fatalities are male. When I first ran across that statistic, I was actually very surprised. I would have expected men to have a higher rate of workplace fatalities. I would not have expected it to be 97%. That virtually all deaths on the job are men. It's, to me, quite startling. And it speaks to the fact that our society is, in many ways, still extremely sex-differentiated in terms of what people do. We really do allocate different jobs and different professions to a large extent according to gender, though we officially don't. I think, in fact, we do. In fact, if someone is a fisherman, is a logger, in the military, etc., doing those very dangerous jobs, there's a very high probability that they're male and that they're going to be exposed to the most risk. Then there's less social support, which classifies here as an environmental issue. It's certainly true that research has consistently shown men to be less socially supported, more likely to be isolated, to have smaller, what are referred to as social networks, that is, to have fewer people to whom they feel connected and by whom they feel supported. Women seem to be far more skilled, or perhaps just more able, more likely to be in a position to be connected to more people, and to have relationships that feel supportive, that are more intimate, that are more bonded. Men are far less likely to have those kind of supports. And that's a social support variable that's been shown to have a very strong relationship to health outcomes. People who have fewer areas or lines of social support are far more at risk for serious or fatal conditions. Behavioral factors. Higher levels of risk-taking, of course, have been shown to be true for men, not a surprise. Avoidance of health care. Men have less tendency to go in on any kind of regular or routine basis for attention to their health needs. Refusal of preventive lifestyle changes. There's a real gender difference there. Women are far more likely to take up healthy lifestyle changes in terms of regular and sustained exercise, in terms of nutrition. And nutrition is actually a big difference. Men, as a group, on average, eat badly, and it really gets them. They pay for it quite seriously. But tending not to take that very seriously, not wanting to make those changes, just not wanting to go there. What a lot of the research also talks about is what's defined as a masculine role. So it's a socially defined error message on my screen there. Oh, look, it says Apple software. Right. Speaking as a PC guy, something has to be done to rescue this. I'm going to close down every window I can find here. Oh, things happening. Okay. Good. Masculine role, like always knowing what to do if there's a technical problem. So those researchers have been looking at the fact that men are given different identities, they're socialized differently, they have different expectations for how they should behave in order to actually feel masculine, in order to feel like a man. And some of the things we've talked about, like high levels of risk-taking or risk acceptance, like avoidance of health care, like not paying attention to your body if it's giving you messages, have traditionally been considered part of what is masculine. And that's been considered to be something that likely is contributing to some of this degree of increased risk. And I'll talk a little bit about that. But one point I want to make about the masculine role research and what you may hear about it, it's quite an important one, because what some researchers have taken from this is that men are their own worst enemies, men are causing their own problem by these traditional masculine values. It's important to recognize that all of those behaviors and attributes that can lead men into big trouble are also the attributes and values that are part of the virtues of being male that our society actually relies upon. We need people who are willing to take high risks, because it turns out we have a lot of things that have to be done that are really risky. We actually have to have people willing to go to Afghanistan and do what we want done there, and it's really an unsafe thing to do. There's no way that's a health-promoting activity. And I've recently been on a mental health advisory committee for the military, and I've been learning about some of these situations and meeting soldiers and talking to people there, and it's really been an eye-opener. But as they describe what it's like to be driving those trucks in Afghanistan, knowing that there are these improvised explosive devices on the roads, and there's a reasonable chance that you're going to be blown up and lose your legs, I'm astounded at the kind of courage it takes to get out and drive that truck. because I'm not going to be driving that truck. But we actually need people to drive those trucks, and we need people to do logging, and we need people to do fishing. We actually need people to do dangerous jobs. So we actually require risk-taking as a virtue. It has a dark side when it's an attribute that is inappropriate, when it's somebody who's simply driving stupidly and quickly and therefore dying for it. That's just dumb. But the other side of each of those attributes of men is also a virtue. These are the conditions. When we looked at the years of life lost that Larry was talking about, potential years of life lost because of dying early. And dying early in this case means excess mortality for men compared to women. The years of life lost by men over women is the reference that we're doing. We're assuming men in theory could live as long as women. Let's find out why they don't. The main reason they don't is cardiovascular disease. That's the biggest contributor. Men are developing cardiovascular disease at a much higher rate, and they're developing it often 10 years before women start to have heart problems. So men truly are more at risk for cardiovascular disease, and it's taking a lot of years of life away from men. Big predictors for cardiovascular disease in terms of risk factors that you might be able to do something about are nutrition. Men aren't eating fruits and vegetables. They're eating lots of sodium in their diet, developing hypertension. They're putting themselves at risk. Exercise, sustained exercise. Men tend to have more issues with overweight as they get older. It's a really big risk factor. And interestingly, some recent research coming out showing that problems with chronic anger and poor anger management is a risk factor for cardiovascular disease. Again, in men, not in women. It's a specifically male risk factor. And the management of anger is often not thought of as a health problem, but it is. A poor management of anger is something that leaves you at risk, especially if it's combined with not engaging in healthy lifestyles, eating badly, and so forth. The second one down is suicide. Now that rather surprised me in the terms of its magnitude of contribution to men's reduced lifespan. Suicide is a big contributor because men commit suicide 3 or 4 times as often as women do. Women have much higher rates of attempting suicide, but men are using much more lethal methods. They're more determined to die. They act more quickly on a thought, and they act in a way that often leaves them, there's no getting out of it. There's no surviving it. So men are more likely to be using methods like gunshot or hanging, things that are far less forgiving as a method than something like an overdose. Men seem to be more determined to die. They're acting in a much dangerous way when they're suicidal. We don't really know much about that. There isn't a lot of research on male suicide. And as someone who's been working with suicidal people for 25 years in the psychiatric emergency unit, that rather startled me, and the fact that I hadn't really been aware of it or hadn't really given it priority. We don't know a lot about male suicide, and it's a huge problem for men and a huge contributor to years of life lost, and it's often happening at relatively young ages. What's interesting is that historically, suicide rates were highest in some countries for young people, teens and 20s. In other countries, they were highest for old people, 70, 85. That's where the highest rates were happening. But something new, a whole new pattern has emerged in the last 10 years in the U.S. and Canada. And this pattern now shows the highest rate of suicide to be middle-aged guys. We don't know why. No one knows why this is happening. There's lots we don't know.